Hello everyone, Sat Shri Akal Saranu. This is Navjeet Kaur and today I am back with some facts about digoxin drug. Basically, digoxin is used as a cardiac stimulant to induce strong contractions of heart when your client is in cardiac arrest or when heart is in fibrillation or client is having tachycardia. The contraction rate is high but the force of contraction is weak. That will lead to the decreased cardiac output, and to treat those conditions we can administer digoxin in those clients. This is a very important drug to know as a cardiac drug for Nclex. Next is digoxin's mechanism of action. Now, how digoxin works? Digoxin holds the calcium within the cardiac muscles and that will lead to the strong cardiac contractions. Basically, digoxin induces stronger contractions but it decreases the rate of contraction. So it will cause bradycardia in our client. If your client is already having bradycardia, then you have to hold the drug and notify the healthcare provider about the bradycardia. This is why you have to assess apical pulse before administering digoxin drug to your client. Second thing is toxicity. You have to assess or you have to monitor your client for toxicity sign, as this drug will cause toxicity in your client if the level increases than 2.0 in your client. Early toxicity sign of digoxin is that your client will have vision problems. Your client may complain of having blurry vision. Nclex used to trick us by asking us such questions like, you have a patient, your patient is taking digoxin and now patient called you and patient said that after taking the drug your patient is unable to read book. So they are not stating that patient is having visual problem, they are stating that patient is unable to read his book. That indicates you patient is having a vision problem that can be due to the digoxin toxicity. You have to monitor the serum digoxin levels in your client and those levels should be less than 2.0. Next is potassium levels. Normal potassium level is 3.5 to 5.0. This range you need to remember for Nclex. If levels are less than 3.5, then your client will be at a high risk of having digoxin toxicity. Low potassium will put your client at risk for digoxin toxicity, and you have to monitor that client for signs of digoxicity such as vision problems or vision changes. Take your paper and your pen, write it down. The next point that you need to know about digoxin is, if you are putting your client on digoxin, always have Digibind available on patient's bedside, because Digibind is a antidote for digoxin and we have to have that available on patient's bedside. I hope you like this video, and if you want to crack your Nclex, you can join Eagle Academy for online Nclex coaching classes. Thank you so much.